Hello everybody, this is Dr. Cohen of Heron Lakes Spine and Wellness Center. Today I want to talk to you about your spinal nerves and about the organs that they affect. See, most of us think if we have some type of pain or we have numbness or tingling that all it's affecting is, maybe musculature or the nerves. But in fact, your nerves coming out of your spine affect every organ in your body. I'm going to show you right here what's going on with that. So most of you may know or may not know how the nervous system works. Well, the cranial nerves, with the spinal nerves, everything starts with your brain. Your brain tells your body what to do. So it's kind of like if you have a computer, to make it very simplistic, if you have a computer, a nice tower you just bought, and you want to start utilizing it, well, you have to plug it into the wall for it to get any kind of power. So your power starts in your brain, and it sends signals instantaneously to your body to make your body function. So the nerves, let's for instance say you have some hand pain, you have numbness in these fingers, you have numbness or tingling here. Most of the time, unless you've had blunt trauma to that area, it's coming from the nerves in your neck. The problem is not in your hand, in your forearm, your tricep, it's from your neck. As you can see, the neural pathways, they come down all the way through to your hand. If you have a blockage in your cervical spine, we call that a subluxation. And if you have that, the transmissions from your brain going through to your body are slowed down or completely stopped. So this here depicts on how the body works. If you work all day long and you sit at a desk and you have lower back pain, or you have pain in your knee, numbness in your foot, so on and so forth, it all starts right here. This is your foundation. The nerves that come through your spine, they come out. Most specifically, most people know the sciatic nerve, which is right here. It goes all the way down to your foot. So once again, if you didn't bang your foot, if you didn't hurt your knee due to hitting it somehow, some way, blunt trauma, more than likely it's coming from here. That's the biggest thing we try to express to our patients. We're not going to take care of your pain as much as we're going to take care of where it's coming from, which undoubtedly means once we take care of where it's coming from, the pain will be taken care of as well. That's probably kind of confusing. But we take care of the problem, not your symptoms. So understand, when you have these kind of discomforts or pains throughout your body, numbness and tingling, more than likely it is coming from your spine. Your spine sends a signal to your body in order to make it function. But let's go even a step further from right here. So again, as those nerves, they control everything in your body. Again, they send a signal from your body to your brain. If you have somebody that has a sleeping disorder, if somebody, God forbid, has a kidney disorder, a bladder dysfunction, stomach dysfunction, any of those things, sometimes, not all the time, but sometimes it's because the nerves that come from your body, they actually control every major organ in your body. So think about this for one moment. If we have a nerve blockage in the upper thoracic area, which is around here, if the nerves are being pinched, as we call a subluxation, this signal's going to the heart, going to the lungs, going to the stomach. All of those signals have now been slowed down. So think about this. If this just happened, if you just got a subluxation, which again is a rotation of the vertebra pinching on nerve, that transmission from your brain to these organs has now slowed down. So it's not going to, God forbid, affect those organs right away, but over time, if you could think about it, that slowed down process over time is going to cause potentially disease of these actual organs. So the bottom line is a subluxation of your vertebra throughout your spine can cause and will cause a lot more than just mild discomfort, mild pain. In time, they lead to a whole bunch of different issues, pains, numbness, tingling, organ dysfunction, so on and so forth. So here at Heron Lakes Spinal Wellness, this is what we do all the time. We help patients with subluxations. We help patients to get their bodies healthy. That's what we do. That's what we love to do. So I hope this helps you a little bit in understanding that the little mild pains you may have, or maybe even more significant pains that you may have, are not necessarily coming from where you think they're coming from. They can be potentially coming from the actual spine. Let us here at Heron Lakes Spinal Wellness detect that for you, find it for you, and correct it for you. Thank you very much for your time. This is Dr. Cohen, Heron Lakes Spinal Wellness. Please contact us, 954-341-2256. Make it a great day. Take care.